proceed. First item on the agenda, and this would be the last day for this, is requests for bill introductions. Are there any? Seeing none. Thank you, committee. In that case, we'll move on to the continuation of the hearings on the three budgets we heard the other day. And the first one we have is the Kansas Board of Pharmacy. Now, this is a three-year budget. We're looking at the end of 23 and then fiscal year 24 and fiscal year 25. Are there any recommendations from the committee on any of those? Representative Ballard.
Thank you, Mr. Chairman. I would recommend that we go with the governor's recommendation.
Are you talking all 3 years, Representative?
All 3 years, yes.
Okay, thank you. Is there discussion to any of those? Any discussion? Seeing none, all in favor of concurring with the governor's recommendation on fiscal year 23? Oh, okay. I'm informed we need a second.
I'll second, Mr. Chairman.
Thank you.
Representative Clifford.
Representative Clifford seconds. All in favor concurring with the governor's recommendations for fiscal years 23, 24, 25, please indicate by saying aye.
Aye.
Opposed, no. We will consider that budget approved. Then we'll move on to the Healthcare Stabilization Fund. And I would entertain any recommendations on that budget. Now, this is a two-year budget, finishing up fiscal year 23 and then fiscal year 24. Yes, Representative Clifford.
Yes, Mr. Chairman, I'd like to move that we accept the governor's recommendation for fiscal years 23 and 24 for the Healthcare Stabilization Fund Board of Governors.
Second.
And seconded by Representative Ballard. Any discussion on that? Seeing none, all those in favor indicate by saying aye.
Aye.
Opposed, no. All right, we will consider that as accepted. All right, the third item is the Office of Veterans Affairs. And I think we have some recommendations to be made on this. Are they here or are we waiting for Representative Ruiz? Okay. Representative Wahhabism.
Thank you, Mr. Chairman. I move to add $200,000 all SGF to the Veterans Care Assistance Program and add a language to direct these funds to be distributed specifically to the Veterans Service Organization Kansas. The Veterans Service Organization Kansas Veterans for Foreign Wars in both fiscal year 2023 and 2024.
Committee questions? Yes, Representative Ballard.
I think their request was 150.
Yeah, that is correct. 100 it was 150, but the reason why I took the 200,000 was because of when the gentleman was up there, he did say that they had part-time and also full-time. And also, back in the day, they actually made their budget cuts 10% one time and another 10%. So all I'm saying here is for that other 10% to actually be restored now that we have some money, this was back then, to actually be restored to help our veterans here in our state.
Thank you. I would second that, Mr. Chair.
Committee discussion on that motion to amend. Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, no. Let me take a sidebar here, committee.
Chairman, point of order. I spoke with Representative Ruiz in our last meeting, and it was about the VCAP money being added back. Correct.
Which is what we just went through.
Yes.
Okay.
But I also have an amendment.
You have an amendment? Yes. Okay. Representative Clifford.
Thank you, Mr. Chairman. I had the opportunity to visit the Dodge City Veterans Cemetery this weekend and just looked at their columbarium wall. As you know, we heard last week from the general that there was a possible project for a scattering wall that had been eliminated from the governor's budget. So I'd like to move to add 30,000 SGF one time in fiscal year 24 for the scattering wall project at Fort Dodge.
Committee, is there a second? Representative Hobson, seconds. Discussion. Yes.
Again, Mr.
Representative
Chairman,
Clifford.
and I actually have pictures, but I won't belabor the point. There's a very nice area. The existing columbarium is down to the last row, so as you know, there's application for federal funds to increase that. And it just makes sense that when that project's being done, that the scattering wall would be done in conjunction with that. The site is virtually the same.
All right, thank you. And your motion is for fiscal year 24? Am I correct in saying that?
I'd have to look back at their, thank you. Yes, that's correct. Fiscal year 24. Thank you.
Committee, is there a discussion on the motion by Representative Clifford? Seeing none. The motion from Representative Clifford is to spend the 30,000 SGF for the scattering wall in fiscal 24. All those in favor indicate by saying aye.
Aye.
Opposed, no. All right, we will amend as such. Any other recommendations for the budgets for 23 or 24? Seeing none, I would entertain a motion to pass the budgets out as amended.
Mr. Chair, I'll make the motion to pass the budget as amended.
For fiscal year 23 and 24?
Yes, please.
Do we have a second on that? Representative Hobson, seconds. Any discussion? Seeing none, all in favor indicate by saying aye.
Aye.
Opposed, no. Thank you, committee. We'll consider that one passed as amended. Well, next on the agenda, then, we have a budget analysis for the Kansas Department of Health and Environment, Health Division, and I'll call Megan to the podium.
Thank you, Mr. Chairman. You should all have in front of you the KLRD budget analysis. It's the packet with a blue band at the top in yellow font. If you'll remember, the KDHE is made up of 3 primary divisions: the Division of Public Health, Healthcare Finance, and the Division of the Environment. And as a reminder, the Division of the Environment is heard in the Agriculture Committee, so we will not be looking at that portion of the budget today. I'm going to start us on page 20 of the packet, just to provide some background information. On page 20, you see the gray page, and at the top it says federal medical assistance percentage. There are a couple of things that play a pretty major role in this budget. The first is the Human Services caseloads estimate. So just for a little background on that, twice a year, the Division of Budget, KLRD, and KDHE all meet to create a Human Services caseload estimate. This estimate is the amount that the agency will anticipate paying for the Medicaid program. When the agency submits their budget, they use the estimates that we created in April for their budget. I'm sorry, the previous October. And then, no, wait. See, it's even confusing for me. So the agency submits their budget based on one estimate. And then in the meantime, in October, we create a new estimate. And then the governor adds this to the governor's recommendation. So that's why you'll see a pretty significant shift between the governor's recommendation and the agency's recommendation. And it's all in that category of human services caseload. And then in this case, in the case of the budget for the last couple years, there's been a pretty significant shift that's caused by the federal medical assistance percentage, or the FMAP. During the COVID public health emergency, there is a 6.2% enhancement to the federal share that is paid for Medicaid. So Medicaid is a program that is funded both by the state and the federal government. And for the last couple of years, there's been a 6.2% increase on what the federal government is paying. Now, that's been tied in the past to the public health emergency. So when we're doing caseloads, our estimates are always based on current law. So we'll often base our caseloads on what we know at the time, which really is usually only 3 to 6 months out in terms of when that FMAP will be in place. So as we progress to the next caseloads estimate, we have a better sense of where that FMAP is going to be. And in general, for the last couple of years, that FMAP has been extended. So when we do our next caseload estimates, you'll oftentimes see that SGF go down because the federal share has gone up. So the table at the bottom of page 20 shows the savings that the state has seen thus far from that 6.2% increase. The other information we have, the federal omnibus bill that was signed into law in December, that uncoupled the FMAP increase from the public health emergency, and we now know how it's going to be phased out. So for calendar year 2023, the first quarter will have a 6.2% increase. So this is the third quarter of fiscal year 23. The fourth quarter of fiscal year 23 will have a 5% increase. Moving into fiscal year 24, the first quarter will have a 2.5% increase and then a 1.5% increase. So I wanted to provide that information because this will come up repeatedly throughout the budget. Are there any questions on this portion?
Committee, questions? Seeing none?
All right.
We do have a late one.
Thank you.
Representative
Sorry about
Carpenter.
that, Mr. Chairman. Mr. Chairman, I might add. So it was roughly 78 million a quarter at the old rate of 6.2.
I would say, so if you look at that FMAP savings, that 6.2%, yeah, it's generally
Just
65.
within,
Yeah.
we'll be fine, But so this quarter here, is that a full quarter? It's only 22 million. So it's only down 2%. The FMAP savings, the rate only goes down 2% and it's 22 million. Am I not?
Are you looking at the bottom line?
Mm-hmm.
That middle column there is the FMAP. So the CHIP program also has an increase, a smaller increase with that enhancement, and that's 4.3%. So that's what that column is.
Okay, so there will be, it'll be pretty significant even, the new FMAP. The 4.3 for the quarter will be 50 million or something. Just rounding.
Yeah, I think that's safe, somewhere around there with the 5%.
Thank you. Thank you, Mr. Chairman.
Committee, any other questions? Seeing none, proceed.
Okay. So now I'm going to have you back up in the packet to page 7. I'm sorry, I actually go back to page 5. Just quickly, I wanted to point out on page 5, this top table here is the budget summary by category for the entire agency. And then below that are the state general fund expenditures for the agency as a whole. In that chart, the agency's estimate is the green line and the governor's recommendation is the yellow. So now I'm going to move forward to page 7. At the top of page 7 is the summary of the budget request for fiscal year 23. After the legislature met for the 22 session, there were some funds that were reappropriated for the agency. The agency had approximately $64.5 million reappropriated. Of these, about $46.6 million were associated with the human services caseload estimates. And that was largely because the member estimates that we had in our estimate were slightly higher than the actual estimates. And then there were about $12 million that were associated with the Division of Healthcare Finance, and that was largely due to positions that were unfilled, that they did not need funding for. You'll see that the agency requested a revised estimate of $3.8 billion, and that includes $961 million SGF, and that's for fiscal year 23. This was an all funds increase of $44 million, or 1.2%, and an SGF increase of $773,000, or 0.1%. And that is above the amount that was approved by the 2022 legislature. On the next page, on page 8, there is a list of the major adjustments that were made in the budget. In number 3, you'll see that there are agency supplemental funding requests. The agency requested a total of $1.2 million from all funds, and that included $773,000 SGF for supplemental funding requests in fiscal year 23. I will go over these in more detail. But in fiscal year 23, the requests were two full-time employees for legal staffing in the administration program, 2 employees for the public health, local public health programs in the Division of Public Health, 11 new FTE positions in Medicaid administration, and then also funding to support an increase in state printer costs. Number 5 are child care worker bonuses. The agency's fiscal year 23 estimate includes $56.9 million in federal funds that were provided through the Child Care and Development Block Grant. These were funds that were allocated by the American Rescue Plan Act and went to provide child care providers with a one-time bonus. Number 6, you'll see there is a reduction in federal funds in the Division of Public Health. These are largely COVID-related funds that are being reduced. For the most part, these were in epidemiology and laboratory capacity or funding immunization or COVID-19 testing programs. All other adjustments, there is a decrease of $5.6 million. This is an increase of $155,000 SGF, and these are just due to a variety of shifts in federal funds for grants across the agency. The agency's revised estimate includes 1,803.7 FTE positions. This is an increase of 79.6 positions above the number that was approved by the 2022 legislature. These include additional 33 FTE positions in the administration function, 46.5 in the Division of Public Health, and 17 in the Division of Healthcare Finance. Most of these are associated with the public health emergency and are funded through federal funds received via that public health emergency for the most part. The governor's recommendation for fiscal year 23, the governor recommends expenditures of $4.0 billion. That includes $801.8 million SGF. This is an all funds increase of $265.1 million. and an SGF decrease of $159.3 million. The governor's recommendation also includes 1,799 FTE positions. This is a decrease of 4 positions, and that's due to the governor not recommending some of the agency's supplemental requests. The major adjustments that are included in the governor's recommendation are not recommending the agency's requests for supplemental funding. Overall, this was a decrease of $710,000 from all funds and $524,000 SGF. There is also an adjustment for human services caseload. The governor recommended adding $265.8 million from all funds, and this is a reduction of $158.8 million SGF, and that was to fully fund the human services caseload estimates from the prior estimate. The increase or the changes that you see in the caseloads, like I said, the SGF decrease is largely due to that enhanced federal funding being extended from one estimate to the next. And there is an increase in federal funds due to the Healthcare Access Improvement Program. This is a hospital provider tax. The amount was changed by the fiscal, I believe it was the 2020 legislature. The legislation was passed to raise the provider assessment. This was then needed CMS approval, which was granted, and the HCAP program was changed as of the start of fiscal year 23. I'm happy to stand for any questions in fiscal year 23.
Committee, questions on fiscal year 23? Representative Barth.
Thank you, Mr. Chair. I just had a few questions on page 5 there. There were some things that weren't really spelled out that I was hoping maybe would be spelled out a little bit more around contractual services. You know, those are some of the bigger portions, commodities, other assistance, like, do the other assistance fall under some of the things we talked about already, or are these outside of that?
Other assistance is almost entirely made up of the Medicaid funding that goes out to individuals, to beneficiaries.
And then contractual services and commodities, that was up under the top section there.
Yeah, contractual services I'll go into a little bit in fiscal year 24. There were some shifts in healthcare finance.
And then the other question I mean, this isn't a big item, but I just hadn't heard anything about the child care worker bonuses. What is the child care rescue plan? What are we doing there? And who is providing, I guess, who are those folks and what are we, other than a bonus, what are they doing?
So the American Rescue Plan is the federal act that provided discretionary funds to the state. And then these funds are approved by the State Finance Council. So these are funds that went through KDHE to child care providers, and they provided a one-time bonus. And the bonuses ranged from $750 to $2,500 per person.
Okay, so it's federal, that's why it didn't go over as much. Okay, right. Thank you.
Committee, other questions? Representative Droege.
Thank you, Mr. Chairman. I just had a question on this HCAIP funding. It's a one-time thing. I assume that's all going to go down and those employees are going to go away.
The HCAP that I referred to with the human services caseloads.
Yes, there were quite a few new hires.
I don't know of any new hires with HCAP, but HCAP, it's a provider assessment, and the way it works is the hospitals pay a tax based on their net income, and then that is used, that goes out, and it brings down extra federal dollars because Medicaid is reimbursed at a 40% state, 60% federal funds. So it brings those federal funds, additional federal funds into the state, and it's then dispersed back out to the hospitals.
So I'm asking probably the wrong question. I'm just curious because there were so many extra people hired during this manufactured crisis we just went through, and I assume they're going to go away. And am I right or wrong, or?
There were additional, yes, there were additional FTEs in the agency's revised estimate, and the agency has reported that those are largely affiliated with federal funds, and they can speak more to that. I know they have some slides that they'll go over that can answer your questions.
Thank you.
Committee, other questions? Seeing none, proceed.
Okay, now I'm going to turn to page 15. Sorry, I'm taking you on a bit of a scavenger hunt through this, but I'm trying to do it in a way that makes sense. On page 15, you'll see the agency's supplemental and enhancement requests. I referred to these in the fiscal year 23 budget. These are requests that the agency is making on top of the base budget that was approved by the 2022 legislature. So I'm just going to walk you through these and provide not a lot of detail, but please feel free to ask questions. In fiscal year 23, the agency requested 2 FTE positions. House Bill 2087 changed the requirements that agencies are needing to make around rules and regulations, and these were FTE positions to help handle that increased workload. And below each of the requests, that it states if the governor recommended the request or did not recommend the request. The governor did not recommend the adoption of that request in fiscal year 23. The local public health program, the agency is requesting 183,000 SGF. This is 2 full-time employee positions to support the Kansas Train Learning Management System. This is the program that provides professional development to public health professionals, child care providers, law enforcement, and first responders across the state. The total funding of that, $37,000 would go toward the annual license fee, and $145,000 would go to fund those 2 FTE positions. And the governor did not recommend adoption of that request. The agency requested $742,000 all funds, including $371 SGF for 11 new FTE positions for fiscal year 23. 10 of these positions are going to support eligibility and presumptive eligibility services across the state. And 1 would be associated with the Healthcare Access Improvement Program to ensure that funding is paid accurately to the hospitals on a quarterly basis. These positions are subject to the 50-50 federal-state match that comes with the Medicaid administrative positions. The governor did recommend partially adopting this funding to pay for these positions for 6 months of fiscal year 23. The agency also had a request for $127,000 all funds, $63,000 SGF to cover increased costs associated with the Division of Printing interagency agreement. And the governor did recommend that. On the next page, page 16, are the agency's fiscal year 24 enhancement requests. You'll see the legal staffing for the regulation team request repeated in fiscal year 24, and the governor did not recommend the adoption of this request in fiscal year 24. There is a request for $1.8 million associated with the Kansas Regional Public Health Data, the Kansas BRFIS. This is a statewide data collection that creates a report focusing on many aspects of public health across the state. And this funding would help make up for decreased funds and keep the program funded at a stable level. The governor did not recommend adoption of that request. The Bureau of Family Health is requesting $350,000, that's all SGF, for fiscal year 24. This is to promote disease screening, preconception health care, and contraception in programs throughout the state. Some of this money will be going toward awareness activities to increase program utilization that had seen a drop during the COVID pandemic. The funds will also go to provide funding support for the hormonal injection of birth control known as Depo-Provera. This increased in cost in July 2022 from 1 cent per dose to nearly $21 per dose. So this funding will help these programs continue to administer that. And the governor did recommend adoption of that request. The agency is requesting $338,000 for the Stan Clark Pregnancy Maintenance Initiative. This would extend the case management services provided through this program from 6 months to 12 months. The governor did not recommend adoption of this request. The statewide psychiatric access program. This is funding that was part of a recommendation made by the 2021 Special Committee on Mental Health Modernization and Reform. This is a program that provides support to primary care providers and other frontline providers to provide their clients with mental health support. It's a program that has already been in place, but the funding for it is expected to fade out, and so this would allow the existing infrastructure to continue. And the governor did not recommend adoption of that request. The agency is requesting $856,000 SGF for nurse salaries and contractual costs associated with health facility surveillance. These are required surveys of a variety of hospitals and other health facilities. These funds would help the agency keep up with the requests. And the governor did recommend $500,000 for this request. The next one is the local public health program, which is a request that was also in fiscal year 23. This is for the Kansas Train program. The governor did not recommend the adoption of this request. On the next page, you'll also see the Medicaid FTE positions, and the governor did recommend the full adoption of this request in fiscal year 24. Lastly is the request for fiscal year 24 for the state printer cost increases, and this was also recommended by the governor. Are there any questions about the supplement and enhancement requests?
Committee questions? Seeing none.
All right, then I'm going to take you back to page 11. On page 11, you can see the table with line items of the agency's fiscal year 24 request, as well as the governor's recommendation. And the below are each of those line items has a description. The agency requests $3.7 billion, including $889 million SGF for fiscal year 24. This is a decrease of $90 million in all funds, including an SGF decrease of 72% million, or 7.5% below the fiscal year 23 estimate. Number 1, 2, and 3 on this table are referring to those enhancement requests that I just read through. Numbers 4, 5, and 6 are related to the Division of Environment. And number 7, you'll see a decrease of $58.3 million in federal funds. That's because those child care worker bonuses were a one-time expenditure, and they're not included in the fiscal year 24 budget. In much the same way, you'll see a decrease of $64.5 million, and that's because of the reappropriations that were reappropriated to fiscal year 23 that were not budgeted for in fiscal year 24. Number 9 speaks to some contractual expenditure adjustments in healthcare finance. Last year, the agency had a supplemental request or an enhancement request for $9 million, and that was while the the KIMS system, which is the database that ensures that providers are paid and keeps all of the information for Medicaid. While that was under construction and awaiting approval from CMS, the agency had to pay both the state and federal share of that project. This amounted to about $9 million additional dollars. These funds, now that that work is done and CMS has granted approval, can be recouped. So there's a decrease in $9 million that was needed for fiscal year 23 that is not needed for fiscal year 24. There are also some increases in contractual funds. The contracts for the state's fiscal agent, Gainwell Technologies, as well as the eligibility contractor, Conduit, were renegotiated, and there's some increase associated with those. There is also a $7.1 million decrease in federally funded grants in the Division of Public Health. These were primarily grants for epidemiology and laboratory capacity associated with the public health crisis response. You also see that the agency requested 18,005 FTE positions, I'm sorry, 1,805. This is an increase of 2 FTE positions above the number that the agency requested in fiscal year 23, and that's due to the agency's request for enhancement requests. The governor's recommendation in fiscal year 24 is expenditures of $4.5 billion. This includes $752 million SGF. This is an all funds increase of $855 million and an SGF decrease of $136 million. Number 12 on that page, you can see the enhancement requests that the governor did not recommend. This is a decrease that says $34 million SGF, but if you're taking out the enhancements that were included in the Division of Environment, it's a $4 million decrease. And then below that, you can see the enhancement request that the governor did support funding in fiscal year 24. And this was a total of $2.3 million all funds. Number 13, you can see the adjustments made for the human services caseloads. This is an addition of $214.4 million from all funds, and that includes an SGF decrease of $35 million. The governor recommended in fiscal year 24 adding $25,000, that's all from the Children's Initiatives Fund, to enhance funding for the Son and Infant Death Syndrome Network of Kansas. The governor also recommended adding $1.5 million, all SGF, to enhance vision and hearing services for children in the Tiny K program. On the next page, on page 14, you can see that the governor also recommended $2.5 million for a child care pilot project. Number 17, the governor recommended $671 million all funds, including $21 million SGF for Medicaid expansion, and that would begin January 1st, 2024. And then number 18, the governor's recommendation includes $92.5 million in savings associated with Medicaid expansion. This is attributable to provisions that were in the American Rescue Plan that states that had not yet expanded Medicaid are eligible for a 5.0% increase to their regular FMAP. So this is the base FMAP that would cover the general Medicaid population rather than the expansion population. And that would be in effect for 8 quarters following expansion. The governor's recommendation also includes 1,799 FTE positions. This is a decrease of 6 FTE positions below the agency's 2024 request, and that is due to the governor not recommending several of the agency's enhancement requests. The rest of the packet that I haven't gone over is a breakdown of the Division of Healthcare Finance, Public Health, and Administration in slightly more detail. I'm happy to go over that, or I'm happy to stand for questions.
break for questions right now, see if there are any. Committee, do we have questions so far? Seeing none.
Okay. Well, I will point out the tables for the programs. There's very little in them that I haven't already gone over. But you can see on page 24, is the Division of Public Health. There's an explanation of the various bureaus inside the Division of Public Health. There are the agency's performance measures. And then on page 27, there's figure 16, and then a similar figure on page 29 that outline those budget changes that were specific to the Division of Public Health. The major change in these is that the enhancements are, rather than being grouped into one, are listed out line by line. And then you'll see the Healthcare Finance Division is on page 31. Their performance measures and budget summaries are on pages 34 and 35.
We do have a question from Representative Carpenter.
Thank you, Mr. Chair. Megan, on 16, well, on 17, actually, Stan Clark Pregnancy Maintenance Initiative, so they asked for additional funds, but are there funds in there from last year, or is that completely stripping the funds from that program?
So the agency's request would essentially double the amount that is allocated to that program. It would double the amount of time that families were able to access case management services. So right now, the total budget for the program is $338,000, and the agency is asking to add an additional $338,000.
Could I get verification of that, please?
Of the current funding?
Yeah. Thank you.
Committee, other questions? Seeing none. Thank you, Megan, for that presentation. Next, I would call Secretary Janet Stanek to the podium. Welcome.
Thank you. I will keep my remarks really brief because you've seen me already, and I kind of just want to remind you all of how much work goes into this budget, the many moving parts of KDHE. The slides that you have in front of you are familiar. You'll see a list of people that will present today. The team has worked very hard, and again, want to help. Thanks, KLRD, for helping us as well. When we put together this budget, again, our vision, is healthy Kansans, and everything we do in our mission, protecting the health and environment of all Kansas, we want to make sure that we're focused on really the diagram on the page with the pyramid, basically, because all of our agency functions integrate. And we really do try to work together to make sure that we're aligned on our priorities, how we fund, what we use even when we get funding. We are a very busy agency with a lot of important work. Workforce continues to be one of the main focal points for us, as I noted in a previous presentation. So I just wanted to thank you for your consideration of what we're about to present, and see if you have any questions for me.
So I take it you'll be turning this over to someone.
I'm going to turn it over to multiple staff members. Ashley Goss next from Public Health, okay?
Let's just go ahead and call her.
Thank you.
Ashley?
Good afternoon, Committee. Ashley Goss, Deputy Secretary for Public Health. These slides should look very familiar. We presented them to you in full detail last week, I think it was. And so I'm just going to go through them quickly. Happy to answer questions for you if you have questions. Really, if you want to start on page past the pyramid, overall Kansas health rankings. These are the buckets that we focus a lot of our work on. I went in detail over these last week with all of you. So if you have further questions, I'm happy to answer them. Long story short, we moved to 31st in the U.S. for our Kansas overall health rankings. If you recall, I explained that doesn't necessarily mean we're getting worse. You have to look at all of the data as a whole to actually understand how we're moving throughout the rankings. Jump ahead to slide 8, our public health accomplishments. Again, won't read these word for word for you, but some of our accomplishments are listed here. We have many. These are just a few of them that we have on the slide today for you, 5 of them that you can read over. One of them that we mentioned last time was our radiation control program. As you know, that's in the Division of Public Health. They are responsible for surveying all radiation rad equipment in the health world, but they're also responsible for working with our Wolf Creek Nuclear Power Plant and ensuring that they meet all of the NRCA requirements. We're also responsible to practice any type of an event that could happen, any type of release, and we have to do this in front of FEMA and be able to successfully demonstrate it. So we did that last year in August. Full-scale exercise passed without any issues. A lot of work goes into that, both with the counties that are involved with Wolf Creek and with KDHE, Kansas Division of Emergency Management, and all of our other partners across the state. Our cancer section was recognized by the CDC as one of the 4 states with increased cervical cancer screenings from July to December of 2020. They actually called and wanted to know how Kansas was able to maintain that and get people in for those screenings because of COVID, and so many people had stopped going in for their routine screenings. Kansas was able to actually increase the number of people we were sending, and we were also asked to be on the National Colorectal Cancer Roundtable from the American Cancer Society. As you can see, we upgraded our vital statistics registration system. We were able to do that without any planned, unplanned downtime, I should say. And then we have our Rural Health Innovation Grant up and going. And then also our Bureau of Oral Health program has assisted 3 different communities in updating their fluoridation equipment in order to convert it from powder to liquid formulations. Again, just a few of the things that we've done in our division. The list is numerous. On the next page, on page 9, if you recall, we have 7 different bureaus within the Division of Public Health. Facilities and licensing, you heard about a survey request, funding request. This is for that bureau. This bureau is responsible for surveying and inspecting, going out of complaints for any health facility that's essentially not a long-term care. KDADS handles long-term care. KDHE handles the rest of them. Community Health Systems is another large bureau that has several programs within it. Our trauma program, radiation program, rural health program, just to name a few. Epidemiology and public health informatics. That's where all of the epidemiologists work out of, where data is reviewed. Also vital records, which is where you get your birth certificate, death certificates, any type of legal filing certificate is also handled there, very busy to the public. Health promotion, think cancer prevention, palliative care, obesity prevention, diabetes prevention. Lots of prevention work goes into this, is in this bureau. Disease control and prevention. This is where the tuberculosis program is housed. The STI program is housed, which is sexually transmitted infections, immunizations, disease surveillance and screening is also housed there. Family health is another very large program that basically covers from birth to death in the age range. So maternal child health work goes on in this bureau from, like I said, birth to death. And our oral health program, again, is led by a dentist, and it has 3 employees that cover the state. They look at increasing the screenings within not only schools, nursing homes, and then work with communities, as I pointed out, on water fluoridation, etc. Next page is our Division of Public Health budgeted staffing. So as you can see, I know that Kayla already covered some of this, the differences in our staffing. When you see increases in staffing, the majority of those are from the increased federal dollars that we have received because of COVID. And so we still are carrying a lot of those staff. One of you asked if I think it was you, if the staff will go away when those federal dollars have gone away. And the answer is yes, they will go away with that tranche of funding. We are receiving additional federal dollars, not COVID related, but in workforce development in order for us to enhance some work in other areas as well. But they're here while we have dollars. They leave when we don't have the dollars any longer. Please know that some of these federal dollars last for a number of years, through a couple of years, so that we can wind work down. And the next slide is our administrative budgeted staffing. Again, some of the same story there, but Dan Timish, our CFO, can talk specifically about the administration staffing and increase in staffing there if you have questions on that. And he's right behind me. So I'll turn it over to Dan.
Welcome, Dan.
Thank you, sir. Mr. Chairman, Committee, Dan Timish, Chief Fiscal Officer for KDHE. So yeah, looking at slide 11 here on admin, it's, as Ashley said, it's largely the same story. When we get additional federal funding, that's more staff that we need to recruit for HR. It's more contracts for the legal staff to review. It's more grants for the fiscal staff to track and report on. So all of these are funded. The increase here is 31 year over year with the federal funds that Ashley mentioned. The agency did not and hasn't requested additional SGF. And again, these would, largely the positions would go away. We're having a very difficult time in recruiting staff. So most likely through attrition, we would repurpose the personnel into other positions where we need them in the agency. But the positions as they are funded would go away. And I think next we have healthcare finance staff to give you the update.
Good afternoon, Mr. Chairman, members of the committee. I'm Sarah Fertig. I am the Medicaid Director within KDHE, and my slides start on slide 12. Next slide, please. So I wanted to talk a little bit about the Division of Healthcare Finance, which is the Medicaid division in KDHE, and highlight some of the accomplishments over the last year. So we have many more than this, but these are some top level ones that we wanted to be sure to highlight for the committee. So first, as Megan Leopold indicated, we finally received approval from CMS to expand the Healthcare Access Improvement Program, or HCAP. So this is a program whereby we impose an assessment on hospitals. We take those revenues from that assessment and use it to draw down federal matching funds, which are then distributed across hospitals in Kansas. So it's a way to help support hospitals with the goal of increasing access to health care and hospital services for Kansans. What's different about this expanded program since it went live in 2022 is that it is no longer reliant on state general funds as a backstop for the funding. Under the previous program that operated before 2022, if we overspent, we had to come back to the legislature and ask for an additional appropriation. And some years that got to be maybe $8 million, so pretty significant. What we have now is a money in and money out program where we're no longer reliant on SGF to help fill that backstop. So it's an expanded program that is now self-sufficient. So this was a huge accomplishment for the state. I know there was a question about staffing for that program. That it's completely unrelated to the pandemic response, so we didn't receive any additional funding for that particular program, Mr. Chairman. However, one of the FTEs that we are asking for in our budget will help administer that program. So while we no longer need to rely on SGF as a backstop for that program, it does have some additional administrative requirements at the state level, and we really need that extra staff member to make sure those quarterly payments are calculated correctly, the money goes out right, and that it truly is budget neutral to the state. So there is a tie there. We are looking to add one FTE to help assist with that program. We also successfully negotiated for some additional cushion in our Section 1115 waiver budget neutrality cap. And a lot of CMS jargon there, but essentially what this means is that the type of federal authority under which we operate our Medicaid program comes with very strict spending caps on the number of federal dollars we can spend on Medicaid over a 5-year period. These caps are set by the federal government, and states have virtually no ability to negotiate them. When I first came into this role in July of 2020, the first thing my predecessor told me is you have to watch out for budget neutrality. We are 1.5 years into this 5-year period, and the state is already in trouble. You have to do something about it. And those of you who served around 2021 probably heard me talk about this quite a bit. So what we did is we worked with our actuary. We found some errors that CMS made when they were setting our caps, and we pointed that out to them. I hope diplomatically. They agreed, and the long story short is that we now have about $300 million additional cushion in that federal spending budget. We don't have to spend any of it if we don't want to, but what it means is that we have additional cushion and we're not at risk anymore of overspending our federal spending caps. Had we done that, every dollar overspent from that federal set cap, we would have to repay to the federal government, and every dollar spent beyond that point would have to be SGF only, which would be catastrophic for a Medicaid program that is quite expensive, and typically we spend about 60% of every dollar using federal funds. So that was a huge success for us. We also secured CMS approval to extend Medicaid eligibility for pregnant women to 12 months postpartum. That was in close partnership with the legislature in 2022, who authorized the funding for that. So that is a huge success for us. And then the last one I want to highlight, a lot of detail on this last bullet. The long and the short of it is that we have made huge strides on the Medicaid eligibility side. We used to have quite a few problems at the CanCare Clearinghouse, both in terms of backlogs of applications and accuracy of the applications being processed. We're very pleased to report that we've seen a huge increase in accuracy based on these reviews that CMS does periodically. It's called a PERM review, the Payment Error Rate Measurement. So in 2019, the Medicaid eligibility error rate was a little over 27% erroneous. That's down to 6.82% as of 2022. And for the Children's Health Insurance Program, or CHIP, that eligibility error rate decreased from about 31.5% down to a little over 15%. So huge strides there in improving the accuracy of our eligibility determinations. Next slide, please. And just a real quick comment here before I turn it over to the rest of my team. One of the goals of the Medicaid program over the last 4 or 5 years is to try and improve some of our major IT systems. The backbone to the Medicaid program is the Medicaid Management Information System, or MMIS. Until April of 2022, we were operating on a 20-year-old system that had launched in 2002, which in IT terms might as well have been 2 million years ago. So after a number of years of careful planning, we were able to launch our new modular system known as KIMS, the Kansas Modular Medicaid System. And that's going to allow us to do a lot more in terms of data work, improve the provider experience and interacting with that system, and just make the Medicaid program a little bit more efficient. So that was a huge accomplishment to finally get that off the ground, and we wanted to make sure to share that with you all. So I think that concludes my piece, and I think I'm going to turn it over to Mark Heim, the Director of Finance. Were there any questions, Mr. Chairman? I'd be happy to stand for them.
Apparently. Representative Ballard.
Thank you. Would you, since this Kansas modular Medicaid system is really new, and I remember us briefly talking about this, but don't know a whole lot about it, could you just tell me a little bit more about it?
Sure, I'll try. So IT is not my forte, so I will try and describe it a little bit. So it's a modular system, which means that we have different chunks of this fiscal system that are kind of plug and play. They interact with each other, but it's more modular. So if you needed to replace one of them or upgrade one of them, you could do that in this kind of modular world. It's also meant to be more efficient at driving data interactions between different systems, just making it more streamlined generally. I'd be happy to share more information if you'd like some more details on how KIMS work, but it was a much-needed upgrade to our 20-year-old MMIS system.
I remember our conversation about that. Something had to give.
Yes, indeed.
That's great. Thank you very much. Thank you, Mr. Chairman.
And I know I'm running a risk of asking a question as well. Let's go back to the 1115 waiver that you referenced. You were able to successfully negotiate a higher cap, which is good news. And that waiver expires at the end of this year. Can you talk about the renewal, where that's headed, or
Certainly.
and the direction the department might be going?
Sure, certainly, Mr. Chairman, thank you. So yes, our current Section 1115 waiver expires at the end of the year. So it was in effect from January 1st, 2019, runs for a 5-year period, so it expires at the end of this year. Last year, we had a lot of discussions with the CanCare Oversight Committee in particular about where the state wanted to go next. Working with our actuaries, what they advised is that the state would find themselves in the same budget neutrality crunch if we were to renew the CanCare waiver in its same format. Basically, we would be having these discussions again and again and again, and we ran into some issues in 2021 and 2022 when the legislature wanted to make major investments in Medicaid in some fashion. So the Certified Community Behavioral Health Clinics, CCBHC is one of them. The expanded HCAP program, that was another investment. These things were interfered with by our 1115 waiver budget neutrality caps. So what we were hearing from our actuary is that that strain would continue if the state wanted to renew the waiver as is. So we started looking for different options. And what we landed on, with the support of the Bob Bethel Committee and the Special Committee on IDD Waiver Modernization, was to basically take the CanCare program we have now and uproot it from the umbrella 1115 waiver that we have now and move it into other sources of authority. So the program itself won't change. If you are a provider, if you are a CanCare member, you would not notice anything is different. What we're doing is liberating the state to the greatest extent possible from those hard CMS set spending caps. So we're in the process of that now. We submitted our renewal request for what we're calling a skinny version, a shrunk down version of an 1115 waiver at the end of December. And then later on this year, we'll be submitting companion approvals to CMS to make that authority shift permanent. And all of that would go into effect in January of 2024. So, Mr. Chairman, we are in what I believe is the 11th to last month of we're operating under our current budget neutrality caps.
And did I hear you say the cap is now 300 million higher than what they had originally told you?
Yes, Mr. Chairman. At one point, we were running close to maybe $8 million of wiggle room over a 3-year period, and that was it. And then we were able to buy some time by having CMS approve that correction to their calculation. And that bought us about 300 million in additional wiggle room. So we're in good shape now.
Thank you for that. Any other questions before we move on, committee? Seeing none.
All right, Mr. Chairman, I'll call up Mark Heim, our finance director.
Good afternoon, Mr. Chairman and members of the committee. I am Mark Heim, Director of Finance for Division of Healthcare Finance. And so my slides start on page 15. Thank you. The chief driver of our budget is the medical assistance funding, including, so Medicaid is what we call Title 19, and CHIP we refer to as Title 21. You've heard quite a bit about, Megan did a great job with the overview of talking about the consensus caseload process. It's done, as she mentioned, twice a year. And we call it April, spring caseload, and in October, we do the fall caseload. Megan actually is part of that. Legislative Research, Division of Budget has representation there, KDADS, KDHE, and Department of Children and Families is there as well. Changes to that consensus caseload forecast the membership changes, if there's changes to programs, anything that comes down through the legislative process, internal policies, and fluctuations in the FMAP. On page 16 is a chart that shows, the point of this one here is to show you where the population is in our program, the Medicaid, and then where the expenditures are. So as you can see, there's a comment at the top. So the children and parents make up roughly 76% of the population, so 3/4 of the population. But those groups account for only 35% of the expenditures. And so if you go to slide 17, will show you kind of a follow-up here. So again, the 76%. So the average enrollment of this group is 400,000. That's what it was over the past fiscal year. But so this chart will show you where the populations are in the various groups. And for example, that 400,000 number, if you look at the far right column for 2022, you would take families, CHIP, and the foster care and adoption. And if you add up those three numbers, you're right at 400,000. So that is where that number is coming from. But again, that's where the bulk of the population is, but actually a fairly, only about a third of the actual expenditures in the program. On slide 18, so you've heard FMAP mentioned several times, which is the Federal Medical Assistance Percentage. Lots and lots of acronyms in healthcare finance, in Medicaid, actually in KDH as a whole. So we throw around the acronyms pretty freely. But this chart shows, it's just kind of a running picture of where the FMAP has been, where it is now, so how it changes year to year. I have a few notes at the bottom. The FMAP's based on a federal fiscal year, so the federal fiscal year is October 1 to September 30th versus so different from the state fiscal year. Megan also hit on this, but just again, in 2023, so right now we are still receiving that 6.2% additional FMAP. But as she spoke to, we now know that that's going to be phased out over time. It's going to drop to 5%, then it's going to drop to 2.5% for a quarter, and finishes at 1.5%. So right now we're still gaining the 6.2%, and you saw another page that she had that showed that 6.2% generally is worth about 65 to 68 million per quarter. And I don't have the December number just yet. The page that she showed you had through September. We are just about done with our reporting for the quarter ended December. And so I can certainly provide that number to Megan, but expect to see it about 65, right in that same area. It's been very consistent. So on slide 19, this is referring to Medicaid expansion. Kansas would receive an additional $370 to $450 million in additional federal funding over the next 8 quarters if Medicaid were to be expanded. And she spoke to this as well, but there's an incentive for states to expand that's on the table, and that would gain you additional 5% increase to the state's FMAP on the existing CanCare population. And that's a fairly wide estimate, I realize, on the 370 to 450, but there's been quite a few different groups weighing on where they think that might shake out. So the governor's budget, as was mentioned, includes expansion in beginning January 1 of 2024. So keeping in mind, so in 2024, it'd be half of the 2024 fiscal year. And again, those costs would be offset by this 5% increase to the state's FMAP, or approximately $92.5 million. And as Megan pointed out, a savings of about $71.5 million in 2024 to the state general fund. Then actually we can jump to slide 21, please. Thank you. Here again, you've heard quite a bit about supplemental requests. So these two were specific to healthcare finance and were actually recommended in the governor's budget. The first one is for the Medicaid FTEs. One of them is an HCAP program, as you heard, that just the Medicaid director spoke to that, and then the other 10 are in the what's called the presumptive eligibility program. And then also you heard mentioned these Medicaid state printer costs. So, and again, these numbers here come at a 50-50 match, state, federal. On slide 22 are the enhancements, so for fiscal year 2024, and just quickly, I would point you to bullet points, the second item, the fourth item, and then the very bottom. These are in 2024 enhancements for the agency as a whole for KDHE. The ones that I'm pointing out are specific to the Division of Healthcare Finance. So just wanted to make that connection. But with that, I think 22 is my final slide. So happy to stand for questions now. Or
is there another presenter? Okay. Yes.
And I'll turn it over to Dan Timmons.
Okay. One moment. Hang on. We do have a question from Representative Carpenter.
Mark, thank you for being here. So I'm trying to figure out on this page here, it has that there will be a net savings from Medicaid expansion of $71 million. So where is that in the budget?
It's, you know what, I didn't walk, well, yes, I did. I might need Megan's help, though, if you can. I saw it in your handout, Megan. It's in the budget in 2024.
It's just in the large
Yeah.
number. It's not broken out or anything.
It's under it.
11, thank you, Megan.
I'm looking at the bottom of page 22, 671.4 million, including a savings of 71.5 million in SGF.
Right, and so the savings comes from that additional 5%. If the state would expand, the additional 5% using a fairly the lower end of that wide range of an estimate on what it might bring to Kansas. So we estimate about $46 million per quarter that we'd gain from that extra 5%. So if we expand Medicaid, so for a half a year, you'd draw 46 million times two quarters, so 92 million. And then so if you take that 92 million that we would draw down from the feds would offer us, minus the 21, yeah.
So if we were to not expand Medicaid, we would subtract $71 million out of our budget?
According to the, oh, sorry.
Megan? We would add 71 million, I'm sorry.
Correct. So if you,
Yeah.
yeah, it would add
We
70.
would have to add $71 million to our budget that is accounted for here by expanding Medicaid.
Correct. So if the legislature chooses not to expand Medicaid, then it would be an addition of 70,000 SGF.
70 million, right.
Yes, sorry.
Okay, because it's subtracted out of here because the governor's recommended Medicaid expansion, and we would have to add that back in. Okay, very good. Thank you. Thank you for that.
Okay, Dan, I think we're ready for you.
Mr. Chair, committee. I think we're still on slide 22, but Megan covered these already, so we can move on to slide 23. Starting on slide 23, this is just a visual, so there's obviously a lot of moving parts. Megan did a good job of going through all the details of that. But you can see here for the current fiscal year that 65% of our funding is federal dollars. So as an agency for health, 2/3 of our funding comes from the feds. The federal share of Medicaid, obviously including the 6.2% FMAP increase we talked about, is the biggest part of that, and then public health also has a lot of federal grant funding. The second largest source then is SGF, 20%, and then moving on from there, fee funds is about 15%. Our biggest fee funds, to give you an idea of the nature of that, in the healthcare finance division, is drug rebates. That's the biggest piece of it. There's escrow recovery monies in the Medicaid program, intergovernmental transfers that we get. There was some talk about the HCAP program. There's a provider assessment there that brings in the state share of the HCAP. That's a fee fund. On the public health side, we have a number of fee funds, newborn screening, the civil registration from the Office of Vital Statistics. They collect fees. We have a trauma fee fund, and so on. And then after fee funds, we have the Children's Initiative Fund. That's about $8.5 million a year towards various infant toddler type programs, and then followed out by trusts. On the slide 24, then looking at the expenditure side, you'll see that almost 90% of our expenditures are aid and assistance. As Megan said earlier, this is largely the Medicaid and CHIP programs, as well as the aid to local programs within public health. Our second largest expense would be contractual services. These are things Sarah alluded to, the keys and the KIM system, so there's a lot of IT system support for that. We have a fiscal agent, Gainwell, certain eligibility providers. I think over the last several years on an IT standpoint, we've gone to a lot of cloud-based services and data hosting now, where that's all cloud-based, so a large contractual expense for that. And then number 3, salary and wages makes up about 2.4% of our overall budget this fiscal year, and then followed by commodities and capital outlay. Very similar for 24, looking at funding sources on slide 25. The big difference would be on the federal dollars. We, as you know, it's been said, we included a half a year of Medicaid expansion in that, so that federal funding goes from 65% in 23 to about 68%. On the SGF side, the big mover there would be the $71.5 million SGS savings that was taken out of our budget related to Medicaid expansion. And then in the increased SGF from the step down of the 6.2% additional FMAP related to the public health emergency. And then moving on to slide 26, on the expenditure side, again, under aid and assistance, we have a half year of Medicaid expansion in there, and then the other numbers are pretty much in line with previous years. Slide 27, we always include this, and this is just looking at public health only and looking at the legislature's investment in public health in terms of SGF dollars. An important thing to note here is that about 1/3 of the SGF dollars that are invested in public health do pull down federal funds. So for this fiscal year, the $11.5 million, that draws down about $28.7 million in federal funds, so that's about a 2.5x leveraging of our state general funds to draw down federal dollars. Similar in 24, that number drops to $10.2 million, and we're drawing down about the same number, $28.6 million in federal funds. So that's a good use of our state federal funds. And then if you look at the non-match portion of SGF for public health, it's $25 million and $28 million, and the asterisk down below indicates what that's made of. I mean, it's primarily our primary care program, as well as our aid to locals and Tiny K and others. And I think with that, Mr. Chairman of the committee, that's the end of our formal presentation. Thank you.
Very well. Committee, what questions do we have? Representative Barth.
Thank you, Mr. Chairman. This question would be for you, Dan, I think based on what your presentation you just provided us. So I'm looking at slide 23, and this is a question I have about the fee funds. It's the 15% of the budget, that purple one there, that's 592. You said primarily that's drug rebates. And so that's a huge amount of drug rebates. You would think that we'd see almost a quadruple the size expenditure for something like that on the other slide, the second one. So where does it fall under? Because that has to do, if it's drug rebates, we're giving out pharmacy, correct?
Yeah, drug rebates would be rebates from the pharmaceutical companies that are involved in the Medicaid program. And so a lot of that I mentioned drug rebates as an example of a fee fund. It's definitely our largest fee fund source of revenue. And a lot of that is all used to support medical assistance to our Medicaid members. It specifically can be used only for Medicaid expenses. So you would see it then on the expenditure side, primarily in the aid and assistance category.
Do we implement anything from a pharmacy standpoint that looks at, so in my business line of work, we look at a lot of things like rebates and such are not as transparent. You know, better cost is, I like flat rates, better cost, generics, carve-outs, things of that nature when it comes to pharmacy. Have we done any of those things there? Because I mean, I know that's a $1 billion number there, so that does make more sense that that's huge, but which is why we have such a large rebate. So I'm just wondering if we would need so much
Sarah can
rebate if we
speak to it
had
in
a
more
lower
detail.
cost on the front
sorry,
end,
sorry.
on the expenditure side.
Yeah, we do have Annette Grant is her name. She is the, I'm not sure what her title is. Pharmacy Programs Manager. And so there is a team within Sarah's organization, Healthcare Finance, that works with all these pharmaceutical companies that, you know, does a lot of analytics around that, looks how to optimize our revenue within the Medicaid program related to drug rebates. And that's about the extent to which I can speak to that, but it is. We do have technical staff within the program that's always looking at that and managing it.
That is part of it, yes.
Excuse me. Secretary, if you have a comment, would you come to the podium?
We do have a formulary review committee in the Medicaid program, if you're asking about efficacy and efficiency of those drugs, which I think you were getting at based on your background, but that's part of it as well.
It looks at cost and other options, but yeah.
Yes, yes, and they meet monthly? Formulary review? I don't recall. But it's a regular meeting, and there's a clinical team, physician-led, so hopefully that helps. Apologies, Chairman.
Thank you. Thank you.
Representative Hobson.
Thank you, Mr. Chairman. I have a question for the Secretary.
You'll get your exercise.
With respect to your Division of Environment, no one actually spoke here in regards to that.
We're presenting tomorrow on environment.
I guess I will reserve them till tomorrow then.
Okay, thank you.
Sorry about that.
But not in this committee, right? This? No. Yeah. Yeah. If you have a question, you should ask it now, Representative.
You may come back up again. I'm just curious to know, with respect to the environment, what is the department doing with respect to helping counties with recycling programs per se?
We have, as far as the new law that went into effect?
Yeah, because with respect to waste management and all of that, I mean, there are some counties that have actually stopped recycling, and in terms of, for better air quality and all of that, recycling does, managing our waste that way. There are studies that actually have proven that by recycling actually helps air quality, food quality, and all of that. So my question is, is there anything in the budget per se that will actually help counties that are looking towards, starting recycling programs per se, or is there anything that your department or you're overseeing that will help counties in our state that are looking towards recycling?
I can't answer specifically, but I can get you something specific, and I'm sure that we are helping make that transition. We also give a number of loans out, low interest or no interest loans to counties for different programs, but I would need to talk to our Deputy Director of Environment and get that information if you could let me get back to you.
That's fine, because I just looked at the budget. I didn't see anything on here per se. I didn't know if there was anything that was already in the works or per se with respect to that.
I will find out. Thank you.
Thank you very much.
Okay, thank you.
Thank you, Secretary. Which leads me to a question for Megan. the budget that we're examining, is it only health and the environment has their own budget separate and distinct from this? Am I correct in saying that?
The budget that'll be presented to the House and Senate Agriculture Committees is the same. I'll present from this same packet.
Thank you. Committee, other questions? Representative Carpenter.
I just might add, this is the first time I've ever seen environmental in this section here. So I don't know what happened there, but this is the first time I've ever dealt with environment added into the actual KDHE finance. So, anyway.
So another question for Megan then. As we make our recommendations here in a few days, we will make those recommendations, then Ag Budget will make some recommendations, and those will be melded somehow?
In the appropriations bill, there's separate categories. So the recommendations that are made by the two committees, all of the recommendations will go into KDHE, but they'll remain separate in the appropriations bill as well.
Got it. Thank you. Representative Ballard.
Okay, now that's a little bit confusing to me because, we always get it in terms of Kansas Department of Health. And then when we get the other part, it's been environment. So when you asked that question, I was trying to figure out why. Then I looked again and I thought it's because environment has been included in this. So when we split it out, will, I don't know how to even ask the question, will that part be on environmental? Because that has always been the other part of Kansas Health and Environment. We've never had those two together.
Yeah, this isn't, the way that the budget analysis is done this year isn't a change from past years. It's not a change from the past 4 years, at least, since I've been here. They've always been combined in the same budget analysis, but they've always been heard by separate committees. And because the way that the agency's budget is split up in the appropriations bill, the recommendations stay separate, but they're all under the umbrella of KDHE.
But in this budget itself, there's nothing dealing with the environment.
There is, it's at the very end. It's much smaller than the health portions. Yeah, it starts on page 37.
Mr. Chair. The only one I noticed was the 30,280,000 for capital improvements for finance. Well, I guess it's, 3,875 or something for capital improvements.
Yeah, if you look at the two overall, the fiscal year 23 and 24 tables that I reviewed, there are a couple of items from the environment in there, one being the capital improvements. That's a significant player in the environment budget, as is the agency's enhancement request for a small town infrastructure assistance.
So maybe because they hadn't asked for anything before, I don't know, it wasn't on this budget. That could have been it. So anyway.
Representative Ballard, did you have any more questions?
No, I just said, no, there's just change, hadn't seen it this way, but now that I'll look at, I'm fine, it's just interesting.
Any other questions, committee? I have a couple in that case. I think Dan, you're the man. Page 27, you're talking about, in your asterisk area, it talks about the tiny K MOE, the maintenance of effort. Would you just kind of explain how the maintenance of effort applies to, or maybe someone else from your department, maintenance of effort applies to KDHE, an explanation of it and what all it touches.
Ashley Goss, Deputy Secretary. I can tell you what we have in our narrative, and then any further questions I can bring back to you if it's not specific enough. But to remain in compliance, the individuals with disabilities maintenance of effort requirements, we must ensure the total amount budgeted for Part C services or Tiny K in the current fiscal year is at least equal to the total amount expended for the Tiny K services in the previous year. So that's why we have to ask for the additional dollars. When we ask for it, is because they have to offset.
Okay. I know in the past we've had to kind of walk on eggshells on certain spending bills because of that maintenance of effort. And I'm just wondering what all spending initiatives within the department it touches.
That's the one that comes to mind the most, that whenever we mess with anything in this, then we have to make sure that and take into consideration the maintenance of effort that's required on the backside.
Okay. And one other question for whomever wishes to field it. I didn't see in the 2024 summary of the budget request from the department that they requested funds for Medicaid expansion. And is there a why for that?
Mr. Chair, Committee, so if we could, I'll go back to slide 22. The first 4 bullets here were agency requested enhancements. The last 4 were put into our budget in the governor's recommendation, and Medicaid expansion being one of those. So,
Right, I understand that.
So,
Governor's recommendation. I'm just wondering why the department didn't request it.
I think all I can say, I'm not sure I can explain why that doesn't come from the agency into our submission, but I can tell you that's how it's been submitted and got into the budget every year that I've been at KDHE, which is 6.5 years. So each year that Medicaid expansion was proposed in the governor's budget, it's the governor that puts that forth as a policy initiative.
Fair enough. Any other questions, committee? Seeing none, we'll hear public input tomorrow on this same budget. And thank you for your kind attention. Thank you for your good questions. And we're adjourned.